Okay, brain aneurysm is a relatively rare condition, but it is, of course, something that people become aware suddenly, usually due to a scan for any other reasons. Scans of the head, particularly, are very common nowadays. They are done for headaches, they are done for all sorts of conditions, and they also identify occasionally aneurysms. Aneurysms, you can think of them as little blisters in the side of a vessel of the brain. It can be various sizes and various locations. They develop, we believe, sometime early in life. We don't know exactly when, and they are found often incidentally, as I said. They are of various sizes. They are common. They occur between 2 and 5% of the population, and the majority of them are completely silent. They have a risk of bleeding, and this is really why we are concerned about them, and we need to deal with them if necessary. However, the majority do not need treatment because they are so small, and we have quite a lot of evidence that they do not pose significant risk to patients. However, in order to decide that, we need a number of tests. We need to review them in a multidisciplinary fashion. We need to discuss it with specialists who understand them and deal with them, and decide if anything needs to be done. Also, often aneurysms present with a bleed. We present with what is called as a subarachnoid hemorrhage. This is a much more severe condition. The patient will experience a very severe headache, something that they have never experienced before. It is described as thunderclap headache, or somebody hit you on the head with a hammer, for example. That's how they describe it. It's something that should not delay presenting to hospital. You need to go to your local hospital as soon as possible, because that requires intervention and treatment. It is, of course, important to realize that aneurysms themselves not always present with this type of problem, but it is a potential problem that needs to be addressed. As I said, they are diagnosed most likely incidentally in most people, and they, of course, create anxiety. There are some people that have family history of aneurysms. Their families that have had similar problems, particularly if they have more than one family member that have had aneurysms, then they have a higher risk of developing themselves. So that is something that they have to be aware. And we know that smoking, of course, and high blood pressure are two things that can affect them and delay and produce them, and they are something that we always advise controlling them. If an aneurysm is identified, well, we shouldn't worry too much about it. It was just found on the day of the scan, but it was there many years probably beforehand, quite silently. So a lot of people that come to see me, they are extremely worried. They hear about their diagnosis and they think that they have a time bomb in their head, which of course is not true. So they need to relax. They need to realize that we're dealing with this type of issue quite often. The majority of patients will not need treatment, but of course some will, and then require further advice, further imaging sometimes, further investigations. And then, of course, if treatment is necessary, nowadays it's not as difficult or as dramatic as it used to be in the past. There are extremely capable treatment specialists that can provide this type of treatment, either through an open operation or through an endovascular approach, which can manage the condition. It is, of course, very important to understand it, first of all, before you decide about treatment. And that requires a decision that is not made by one specialist. It often requires a group of us sitting down together, particularly with collaboration with our radiology colleagues. And then in discussion with the patient, we move forward.